A few months after telling us not to worry, it wasn't going to be a big deal, the CDC said today monkeypox is now a public health emergency. 6,600 cases in America and growing. Right now, it's almost entirely a pandemic of the gay community, or in politically correct terms, men who have sex with men. That is an indisputable fact. And here's what the Washington Post has to say. As monkeypox strikes gay men, officials debate warnings to limit partners. Again, Washington Post reporting. They debate warnings. There's a public health emergency going on, and they are debating about whether they should tell people the way to stop it. Let's be clear. We just got done not seeing our grandparents for 2 years. Kids didn't go to school. You couldn't go to church or a bar or a restaurant. People lost their livelihoods. They couldn't say goodbye to loved ones as they died. The list goes on and on. That was all mandated. They were shut down. Our lives were totally altered by the same public health officials who, in the middle of the monkeypox outbreak in San Francisco, let the Door Alley outdoor sex party go on as planned this weekend. In other words, health officials care more about avoiding the stigma of gay sex than preventing a massive outbreak. They continue to care more about the politics than public health. Dr. Bob Lajita is here, among many titles, professor of medicine at Rutgers University. Doc, it's good to see you. Just from a medical standpoint, I feel like this is the most important time to loudly ring the alarm bells and talk about these things. Why isn't it happening?
I don't know. There are 6,600 cases in the United States, the highest number anywhere in the world of monkeypox. It is related to smallpox, and perhaps its limitations to the gay community make it something that people don't want to talk about. There's a lot of innate bias in talking about something that affects a fringe group of people. There's about, I guess, 1.5 to 2 million people at risk in the country, so that's not a small number.
No, it's not a small number at all, which is confounding to me is that you would still allow all of these festivals. There's one in Chicago that's happening next week, a large gay festival. Great, do whatever it is that you'd like to do. But when they shut down so much for COVID, there's the symbol for it, or the advertisement. Market days in Chicago. That's being allowed to go on by the same public health officials who shut everything down for COVID. This I thought was interesting. California State Senator Scott Wiener. If people want to have sex, they're going to have sex. This is him talking to the Washington Post. I know people who normally go to sex parties who will not. People will make their own decisions about their own risk levels. Why is everyone allowed to make their own decision about their own risk levels for monkeypox and not for COVID?
Well, that's a very good question, because monkeypox in that community is spreading. And the interesting thing is, for the most part, it's a self-limited infection, which means it goes away on its own. But it spreads very, very easily. And you can also infect somebody with fomites. That is the material like seat covers and utensils or dishes, etc., that come into contact with somebody with monkeypox can get monkeypox. Wow. And it's alive for 2 weeks on these objects. So it's a little different than COVID.
It seems like we're setting up for this sort of same kind of situation of this uncontrolled spread out of people who traveled to China, who brought eventually COVID back, and then it spreads out. This I was fascinated by, and I want to ask you about this. There are children now who have it. A number of them are the children of gay men who went to these parties, contracted the disease, and then passed it on through contact with their kids. I'm sure, obviously, anyone would never wish this on their child. But there are people now going into the hospital for pain management because of how bad this can get. It seems as though, well, I should put it in the form of a question. Are public health officials taking it seriously enough about how this could really get out of control and where we might be headed with monkeypox?
Yes. So, Leland, we've been alerted to the fact that we have not in the hospital yet been immunized, but we have been instructed to use personal protective equipment, just like we did with COVID, and to be on the alert. In the emergency room, anybody with a pox, frankly, anybody with symptoms, and the symptoms would be big lymph nodes, muscle aches, fever and chills, and having had contact to somebody possibly with a monkeypox infection. We're being very, very careful. Healthcare providers have been alerted throughout the country to make sure that they take special precautions.
Does it? I feel like there's so many similarities to February of 2020 in the way I'm hearing everyone talk about this. Should we be scared that nobody learned anything from COVID? For God's sakes, we can't even figure out how to test for this. The CDC is totally silent on the real way this gets transmitted and the way it spreads so substantially inside the gay community. Is there too much politics at play?
There may be some politics at play, but this is not a respiratory virus like COVID, which is transmitted so easily and so transmissible, as we know, with the Omicron variant. This is a little different. You have to come into contact, direct contact with secretions. And so the children that you described were infected.
I got 30 seconds, but I hate to interrupt you. I'm trying to understand this. You said direct contact with secretions, but then you said things can live on utensils for 2 weeks. I'm confused.
That's right. That's right. So these secretions can be on utensils, plates, etc., and desks, and you can get infected from that. That's the bad part.
Oh, yeah. Well, and the bad part also is what is the disease itself, and we don't have enough vaccines. We go on through the list. Hey, Doc, it's good to see you as always. Thank you for the time. I know we were going to talk about COVID today and people dying with COVID versus from COVID. We're going to have you back next week for that segment. All right.
Thanks, Leland. I'll be back.
Thank you, sir. Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.